Great. It gives me great pleasure to introduce our next speaker, Dr. Jessica Deighton, who is Head of Resilience Research and Evaluation at the Anna Freud National Centre for Children and Families, and also a lecturer at UCL.
Excellent. Hi everyone, I've been sat down the front. This is the first time I've seen you all, so it's quite nice to be able to turn around now. I think I'm going to pick up on a lot of the themes that came out of Professor Layard's talk this morning and Neil. So it's general in that it cuts across in the same way that Mick was just describing lots of different kinds of interventions, but very specific to measurement, which sort of came up as a bit of a theme this morning, I think. So I'm gonna briefly skirt over the current context because I think Neil framed that quite nicely earlier on, and the case for sort of schools being a site for mental health support. But what I want to spend more time on is talking to you about the process we went through to develop a measurement framework to be used in schools, so more generally to monitor mental health and well-being, but could also be used as sort of evaluation framework as well, I suppose. And then I'll talk through some take-home messages for each of you. And also, I've realised there's 3 offers to schools, things that schools may be interested in. So I'll come to those at the end. So, as I say, I'm not going to spend much time talking about this bit because it's already been discussed, but we have a sense of the extent of problems at the moment. Around 10 to 20% of adolescents experiencing mental health problems. I would just say a lot of that we're still quoting literature that came out well over 10 years ago, and even some of the current estimates that I saw coming out in the Children's Commissioner's report are still based on those estimates. So we're saying this is what we know, but actually we're still sort of unsure actually about the current state, and there is a lot of nervousness that problems are increasing. We're maybe not capturing that quite so well, but we have a sense from some studies, albeit slightly smaller ones, that there are some increases, as Neil described earlier on. And we also know that children proportionally received a lot less of the mental health care funding than adults do, and that's true for research as well, as Mick just said. There's a lot less we know about what the evidence base is for children. And we also know that only a small proportion of children ever access sort of specialist mental health services. And we know that there's increases in waiting times, and we've seen lots of evidence emerging about that. So I suppose that sort of sets us up for more news headlines. What we're seeing a lot more in the media, but just in the public consciousness, I think now, thanks to lots of campaigns, but also just a sense that schools really are a site of opportunity. And I think this is probably puts a lot of pressure on schools because budgets are squeezed, as we've been talking about. But everyone's really looking to schools to come up with some kind of magic solution of this gap between the need and the provision that's actually around. And I think that's, a real big ask of schools. We're seeing a lot of policy interest now in prevention, early intervention, and as Professor Layard mentioned this morning, the new Green Paper, makes the communication that have come out so far are making explicit reference to what schools might do, and there's been a lot of communication about, a possible focus on schools, and from DFE now a more focus on mental health in schools as well. And in particular, there's been a report that was just released, I think maybe last month, from DFE, where NatSen and NCB had worked together on a survey of teachers across hundreds and hundreds of schools to ask schools about what they felt their role was in supporting mental health. And so some of the things that came out were that schools very much felt that they were in the business of creating an environment where young people feel safe and feel happy. And part of that is about having those conversations, about sort of making it easier to talk. And I thought it was very interesting what Abby and Mary were both saying earlier about actually just having somebody there to talk and listen and feel believed is quite important. And that's schools feel very much in the business of that based on these findings. But also that schools feel they should be in a position to identify mental health needs. Now that's an area that I don't think the evidence base is great for, but also that they do see themselves having a role in providing more targeted support. And some of that is in school support, like school counsellors, for example, but also referring out to specialist services. So all of that, in a way, to a varying degree, is within the scope of what schools do. And in terms of activity that's actually happening in schools, I'm not going to try and capture the whole range, but even from our own experience, there's a vast array of what happens in schools to support mental health. And some of that is the very evidence-based, programmatic, kind of manualised approaches to much more sort of locally developed, sort of test-in-flight kind of approaches, yeah, even down to just actually being mental health literate and being willing and up for having conversations with young people about mental health. So the vast array sort of exists out there. But what I would say is, in my experience in the last 10 years, there's a lot more happening in schools. There's a lot more schools saying this is part of ordinary business. This is actually what schools are about. I suppose the bit where we're lagging is, if it is part of the school's remit to think about who's in need, how do they get a sense then of what the strengths are of the student population or what the needs are? I think, again, Mary, what you said earlier about sort of appearing on the surface as if everything's fine, you can achieve academically quite well, even if just for a short period of time, while struggling actually with quite a lot of emotional turmoil or distress or other difficulties. So it's not okay for us to just say, well, as long as we know that achievement's sort of happening, then probably everybody's okay. We spent a long time trying to sort of hide ourselves behind that wall of saying, well, as long as there's a relationship between mental health and attainment, so we would know. We wouldn't know necessarily. The relationship's there, but it's not that strong. But also, how do we know about the individuals that need more help? How do we, if those problems are masked to some degree in some individuals, then how do we sort of understand that? How do we know when people are struggling? And also that if we do get to that point where we know who we're trying to get support to, or we've got something in place, then how do we know that that's working? And part of that is about some of the interventions out there being untested, but even the ones that are evidence-based, as Neil said, a lot is down to implementation, a lot depends on context, and we still need to know whether they work when they're actually sort of embedded within the school. And we did a lot of work on this as part of the toolkit. I'm afraid I didn't make these, so you can click them, but I think this one is on Neil's slides. We developed a toolkit for schools and colleges to think through how they might measure and monitor wellbeing. And we consulted with a lot of schools, and these were some of the questions that they had really about how they do these things. And what we learned was a lot of schools are trying to find ways of measuring and monitoring mental health and wellbeing, but they don't know what's out there that's evidence-based. So they're developing their own tools and materials, and they're not really understanding what comes back or how to make sense of it. So we had an opportunity to grapple with some of these questions through a large project that we're involved with the big lottery fund called Head Start. And because it's sort of quite a complex programme, it allowed us to think out those questions in quite an extended way. So I'm going to talk you through what we did and hopefully bring it back to how that might be relevant to practices within schools sort of more generally. So just to give you a bit of a sense, Head Start is it's one of the Big Lottery Fund's strategic programmes. It's trialling a broad range of initiatives to improve resilience and emotional well-being sort of generally within children between the ages of 10 and 16. And it's happening in 6 different areas of the country, which my geography is terrible, so I had to put the blobs on the map so I'd know. So we've got Blackpool, Hull, Wolverhampton, Newham, Kent and Cornwall. And they're each local authority-led partnerships, and they work together with other local services and agencies to try and embed themselves in this very systemic approach that's happening in communities, in schools, with families and so on. But essentially the aims of this programme are to improve emotional well-being, to improve engagement in school and also academic attainment, to reduce the onset of diagnosable mental health problems, and also to reduce sort of risk-taking behaviours. The bits I want to pick up in terms of the measurement framework are the ones that we know really aren't sort of being captured elsewhere. So it's about improving emotional well-being and reducing the onset of diagnosable mental health problems. The other bits we are capturing, but it's more part of routine data, so I won't go into it now, but if anyone wants to ask about that, I'm happy to talk about it. So essentially we took those sort of core questions as our sort of guiding vehicle, if you like, to try and co-produce a measurement framework to sort of measure mental health and well-being, but also some of those protective factors that Neil talked about earlier. So some of the things that we would think of as resilience measures, but things like emotion regulation, coping with stress, relationships with peers, school connection, and so on. And we wanted to work together with local authority leads, with those who work in schools, and with our participation leads who are working with young people to try and find what's the best way to do this that isn't just an academic exercise that gives us robust measures but nothing that can ever be implemented in school, but something that's actually feasible and acceptable and makes sense. So our criteria were basically that measures must have evidence of their reliability and validity. So someone was asking earlier, if we don't have time to read the evidence base, what do we do? Challenge the people who present things to you, like measures, for example. Some of them look very glossy and lovely. Ask them what the evidence base is. Ask them to present to you what the psychometric properties are or what the validation was. Is it reliable? Is it valid? So that was one of our criteria. The questions included must be acceptable to teachers and young people, and that was a number of considerations, I suppose. So part of it was that there was some alarm with some of the questions that can be included in mental health measures about what if that prompts distress in young people and I don't feel equipped to deal with that, how do I manage these things? And also what young people felt about what chimed with them, what they thought was important for us to ask them, and whether the language was right and so on. But also for academics, are these actually, do they have good face validity as measures that we think should map onto what we think the psychological constructs are behind them? And then also issues of practicality. So is there a mechanism of delivery that makes this doable in a class, en masse, that allows it to be delivered in a lesson, that means it's not too long, that means the teacher's not spending lots of time explaining to each child what the questions mean and so on? And are we avoiding duplication because we don't want to add burden if this information can be collected elsewhere? Which is why I put sort of attainment to one side, because we know that's already routinely captured in schools, so no point in duplicating that particular exercise. Oh. We're about to move into the disco part of the day then. So we had a sort of an iterative process trying to find a set of measures which we sort of honed down, which everybody was happy with. And it essentially involved everybody bringing, it was a bit like a sort of bring and buy, so everyone brought the questionnaires and measures they were aware of that they thought were good, and we sort of offered them up to these criteria, and then we tasked some of us as researchers had to go off and find things that might map onto particular territory we hadn't covered and bring them back for scrutiny and so on. And so we went through this process. And if we were unsure or we had two good candidates, it essentially came to a vote. So it's a very democratic process, definitely measurement framework by committee. But I think what we came up with was not what we would have come up with as academics. They are academically rigorous measures, but it wouldn't have been what we came up with, and I think it's all the richer for it. So I'm going to take you through a bit of the detail, just because I think sometimes it does help to know what the questions are to make it sort of more real. So thinking about these different domains, we have the wellbeing, mental health and protective factors. For wellbeing, after a process of whittling down, the measure we ended up with, which I think has already been mentioned, I've seen it on some posters as well today, is the Warwick and Edinburgh wellbeing scale. So it's the shortened version. So basically, these are just quite straightforward questions around subjective well-being, things like I've been feeling relaxed, I've been feeling useful, I've been thinking clearly, I've been feeling close to other people. They're quite general questions, but they're just sort of general positive well-being. And then for mental health, this was the one I think there was less debate on, although I'm sure we can have endless debate. There's lots of measures out there. The one we ended up with was the Strengths and Difficulties questionnaire. Again, it's been mentioned already today. I think it was partly because a lot of the prevalence studies have already used this measure. It's recommended, I think, in the counselling report that Mick mentioned earlier, and it's sort of well used in services as well. So if there's a way for a common language through measures from schools into specialist services, then all the better. It has good norms in the UK and it's translated into lots of languages. So in a way it was a bit of a no-brainer, but there are other measures out there. We could have chosen others. This one just seemed to sort of fit. And then thinking about protective factors was quite a challenge. There's a whole raft of protective factors as sort of shown in Neil's sort of cumulative assets. It's quite hard to sort of whittle that down to a sensible set of questions that have good sort of face validity. So we opted for a survey called the Student Resilience Survey, and it just covers a range of protective factors, some of which fit into what we would call internal characteristics, so things like self-esteem and also sort of problem solving and goal setting, but also covers how well supported young people feel by their peers and also by adults at school and those at home as well. So it's a bit of a sort of a mixed bag, but actually the point is that it's reliable and valid, so it was in. We also added a couple of measures that we felt were important to understand protective factors that weren't part of that scale. So one was about self-regulation. Oh, sorry, I didn't read you out any of the student resilience. So, for example, the support from school, the questions were things like, at school there's an adult who really cares about me, tells me when I do a good job, and listens when I have something to say, and believes that I will be a success. So again, when we're thinking about the role that teachers play, I think that's a really good example of actually just having positive regard and having a sort of someone who thinks warmly about you that you can have a conversation with. That sort of epitomises it for me. Then in terms of the self-regulation questions, we have a small set of questions that are about controlling feelings and being able to deal with stress, and whether you get too involved in something that you can't extract yourself from before it all goes slightly wrong. I'm sure we all have that experience at some time. And then perceived stress as well, which is, it's the most wordy set of questions, but it's about coping with stress, so we thought that was quite important to include. So it's questions like, how often have you felt things were going your way? How often have you felt confident about your ability to handle your personal problems, and so on. So it's a sort of a battery, really, of measures that we think capture a sort of a whole range of what we might want to know if we were looking at supporting mental health and well-being, and what we would expect to change as a result of interventions that are kind of, aimed in that area. I suppose the other thing that's important to think about is how to make this actually really useful for schools. So this might be great for a research project. For us, we can analyse the data, that's fantastic. And we've also put this on an online system, so it's fairly easy to administer, but where's the so what for schools, I suppose? So one thing we're spending a lot of energy working on at the moment, and again, this is with local authority leads, with schools and with young people, is thinking about what feedback on this kind of thing should look like. So what will schools need to know, having invested a lot of energy in doing this, and how do we summarise it in a way that's mindful of the complexity and uncertainty in the data, but also provide something definitive that schools can sort of work on or review. So this is what we're sort of working on at the moment, finding ways to sort of rag rate and summarise the data. So on the right-hand side is a funnel plot. I don't know how many people are familiar with funnel plots. Anyone familiar with funnel plots? Few hands. Okay, so this is our way of sort of conveying uncertainty in the data. So basically, what we have is that each of those blobs is a school. And what we might have, I think on this one we've got, school connection. So that's the set of questions that I read out about, whether there's an adult at your school who sort of interested in you and supports you. The higher the score, the better. Anything within the funnel, really, this sort of thing that looks like this, is not discernibly different from average. Anything below the funnel is discernibly lower than average. So if you're a school scoring in that range, it means that young people in your school feel less supported in some way. Now, there's no judgment on why that might be. There might be all sorts of reasons why that's the case. There might be everything to do with the context and nothing to do with the school, but it's at least a starting point to understand what might be happening there, or where schools might focus their energies if they're showing up as sort of unusual in that respect. Anything above the funnel is sort of better than expected in a way, if you like. So schools might feel quite proud about that, but also might want to think about how they can sort of make sure that sort of stays looking good. So we try and identify schools so for example, we might say you're the green blob, and we might say other schools in your local authority are the red blob, and then the rest of the blue blobs are across the country or something. So we're trying to think of ways to convey that doesn't make it too complex, but sort of gives a level of detail which sort of reflects the amount of energy that schools put into it, really. And I think that's quite crucial. But I think the other thing to bear in mind is there's lots of systems out there at the moment. Again, some of them are very evidence-based and some not so much. The feedback that comes back is not necessarily statistically meaningful, partly because of the measures they're based on, but also partly because of what's been done to the data since it was collected. So just to always bear in mind to query those things, I suppose. So I suppose that's where we're up to in our process. At the moment, we've trialled this measurement framework. I say we've trialled it. We've rolled it out across the country in all of those areas, but also in other schools. And we now have 35,000 children and young people who've completed the measures in Year 7 and Year 9. And we have developed a primary school version, which is slightly different, just simplified questions and slightly shorter, which has been rolled out, I think, about 5,000 children and young people across quite a few schools. And we're just working up that feedback. And the idea is that this first instance where we have baseline data, we will look at whether we can look at sort of prevalence at the moment, given that we don't have any good prevalence data at this moment, although there may be some coming next year, that we can get a sense of the extent of need out there. But also that this serves as a baseline, because for each of these schools we're going to be working with them over a period of years. So in a way, at this point, all we're saying is know your population, and then let's see how it changes over time. And I suppose that's the bit of interest about if you put something in place in the school, how does that change things in the positive direction? So in terms of take-home messages, I've put parts of a Jackson Pollock painting on there to remind me that mess is sometimes beautiful. So I think for researchers, what I would say is, come and embrace the mess with me. Often what happens in practice is messy. A lot of what's happening is varied. As Mick and Neil have already said, a lot of what young people experience does not fit into one particular category of difficulties. It's very rare that someone walks through the door who purely has anxiety, who purely has depression. There's lots of complexity, and there's lots of complexity in what's implemented on the ground as well. But unless we engage with that, we're not going to build the evidence base in a compelling way to understand what actually works and for whom and in what conditions. So I think we've actually got to start testing in flight, and we've got to start building practice-based evidence as much as we build evidence-based practice. So I think that's it. I think if we wait always for the randomised control trial, some things will never get there because the evidence just won't accrue. And then my other plea is about developing psychometrically robust measurement frameworks and trying to use those in a way that helps us build that evidence, or helps build a benchmark for schools so that they can start understanding what the spread of sort of need and strengths is that's out there. For commissioners and policymakers, I suppose, again, it's a similar theme, really. I think routine monitoring can give insight into particular needs. So it might be, for example, that you expected that there were more behavioural issues, but then when you start looking at the data itself, you see actually there's quite a need in terms of emotional problems, or children feel very little support from schools. So those sorts of things help you guide what kind of provision is needed. So that kind of evidence-based commissioning, I suppose. Also, whether approaches are evidence-based or not, they should be monitored in situ, and not just a measurement framework put in place, but actually structures around how are we going to review this, what would we do with the data if it came back and told us something we weren't expecting, how are we going to act on it, and how will we challenge it, because of course all data is imperfect. How would we know if what it says is true, how would we know if it wasn't true, and what are we going to do about it? Yeah. And then for school leads, I think, yes, I'm quite keen on this meme. I'm sure you're all aware that there's increasing focus on mental health supports. It does mean, as Neil was saying earlier, that schools have become a marketplace, and there's a lot of pressure that comes along with that, a lot of pressure to pick something that's right. Just, I suppose, challenge whoever comes to your door saying you should do this fantastic thing. Challenge them, show me the evidence. I made myself very unpopular in a meeting in a school recently where they didn't know my background, where I asked whether there was peer-reviewed empirical evidence for the approach they were taking. And I think why that shouldn't be a difficult question to ask. We should be quite unabashed about saying that. And you don't need to have read the literature to ask that question, so challenge people. And I think the same is true for surveys. There's lots of surveys out there at the moment. I know there's survey fatigue in schools, so if you're going to pick something, again, challenge people on what it is. What are you going to get back from it? Is it psychometrically robust? Is it valid and reliable? And does it provide you with the information you need to review the needs of your populations and whether the support you've put in place helps? And then I think this links to the picture. Quite often, academics and those who spend their time psychometrically testing measures are tentative in their nature. The way they present things is not always the most beguiling way, so just be aware, don't get sort of seduced by what's most shiny necessarily. It may be the right thing, but it may not be, so question it and demand to see the evidence. So my 3 offers for schools then. just to let you know about some things that are happening at the Anna Freud Centre and at UCL that you might be interested in. So the first is that the measurement framework that I described, we are capturing that in, I think something like 120 schools at the moment, some primary, some secondary. But we're rolling that out as an offer to another 130 schools. So it can be the primary school version or the secondary. We're probably going to focus more on the secondary. But if you are interested in that kind of online set of measures and the feedback that comes with it, the details are there. Or I think Lee and Natalie have still got a desk sort of out the front for the Anna Freud Centre on Cork. Please do let us know. And you basically submitted an expression of interest and we'll whittle it down to the 130. But it would be fantastic to have you on board. The other thing is to say the Anna Freud Centre has a Schools in Mind network. It's got about 1,500 members, I think. I can't see Natalie to correct me, but she's here somewhere. Sorry? 2,500. Thanks, Natalie. God, it grows every time we talk about it. 2,500 members. And we have essentially a whole range of online materials, booklets, we have training days, we have regional events. There's a whole range of different activities that Natalie knows much more about than me. But you can basically just become part of the circulation and you're welcome to join sort of any events or use materials. Most of them are free. And then my final offer is we're just on the cusp of starting a very large-scale study of a number of interventions in primary and secondary schools. So some of those are basically would be trained professionals coming in to deliver a programme sort of session by session. Some are about training teachers to deliver things like mindfulness and relaxation and so on, but supporting them through that process and then evaluating it at the same time. Again, if you're interested in being involved, there would be lots of scope for involvement and there is some reimbursement for time for schools as well. So if you're interested, again, please do get in touch. Oh, and I think I'm ahead of time. And that's it. Thank you very much.
Great, thank you, Jess. We've got time for a couple of questions before we finish with the break. Anyone? Yes, the lady up here.
That final offer that you just made to schools, is that any particular part of the country that you're offering that?
So there's 4 hubs. So strictly speaking, it's sort of, but we may radiate out quite vastly from those hubs. So it's just because if there's training, we'll probably focus in those hubs. So at the moment, we're saying it's Manchester, London, Birmingham, and I think Bath and Somerset. But I think, you know, for example, in Reading, if people were willing to travel for training, I don't think that would be too much of a stretch. So if you could get to London, then that would probably work.
There's a lady at the back there.
Hey, I just wondered if you had anything in place to help the schools kind of interpret and use the data that you're providing them?
Yeah, I mean, it's probably more Cork's territory. So Cork, for those who don't know, is the Child Outcomes Research Consortium, and they do tend to partner with voluntary sector and specialist services. Again, Lee, who's sitting at the back. Lee, do you want to just stand up and wave a second? And schools as well. They do a lot of sort of learning and collaboration with all of those sort of different organisations to think about how they make sense of the data they collect. So that might be these kind of measurement frames, but it could be a more practical pulling on what you're using locally and making sense of it. So yes, and I think there's guidance on the Cork website as well, but you could always have a conversation with the Cork team too.
Is there another one over? Yeah.
You said something earlier about it's really important to understand that any measurement might reflect what's going on in schools, but it might also be part of the context. And I was just wondering about how far you guys have gotten in terms of thinking about how to measure contextual factors that might be important. And I was thinking about kind of, we've had quite a lot of flooding in different parts of the country recently that probably has a huge impact on local communities, but there might be things about deprivation or
Yeah, and it is hard to know where to sort of cut off because one can get very bogged down in the complexity and then realise you've come up with something that can't possibly be implemented. But yeah, so at the moment it's quite a pragmatic approach. So what we do for our studies, large-scale studies, is we use data from the National Pupil Database. So when Neil was talking about the cumulative risk and cumulative assets before, what the risks were basically data that we have from the National Pupil Database. So some of that is free school meal eligibility and deprivation, but also the local authority data about looked after children and child in need and so on, and also special educational needs. So it would be great to also have measures, obviously parental mental ill health and economic pressure within the household. You could keep going, but I suppose it's pragmatic, partly because of that criteria about don't collect something that's collected elsewhere. So for schools, what we tend to do if we're working on a smaller scale, obviously they collect all that data routinely to send to Department for Education anyway. So they would have the same fields in common, and we usually stick with those. But yeah, ideally you would add more as well, you're right, yeah.
Brilliant. I think we're going to leave it there. Okay, great. Thanks very much, Jess. Now we're going to...